heat therapy and cold therapy seem to just go hand in hand with each other.
But let's face it, they're as different as hot and cold.
Facts. So which one should you use and when should you use it? Hi, I'm Dr. Crockett, and this is Dr. Sanders with Zeal Integrated Health. And let's just start with some of the basics. When should you use hot and cold therapy? Let's maybe start with hot therapy.
Yep, so hot therapy or heat therapy, you want to use it when you want to improve circulation, increase blood flow. It can be applied in many ways. Hot towel, hot pack, you can get those electric hot packs they have for sale at any corner drugstore. Also, people don't realize saunas and hot tubs can be a form of heat therapy.
Yeah, you see infrared light being one of these great qualities to increase blood circulation. There's some things associated with basically increasing nitric oxide in circulation, which vasodilates and can help with some detoxification processes with those types of therapies as well. How about cold therapy?
Now, cold therapy is different, right? It uses cold, it uses ice. It also can be ice baths. People have heard of those tanks that people go in that are really cold. That's kind of full body, so it's kind of a sauna of ice therapy. But this is more for restricting the blood flow, right? Decreasing circulation, decreasing swelling.
You bet. A lot of benefits with cold therapies, increasing hormones that can help regenerate the body, and that's why you see people using some of these cold tanks or flipping the shower on and turning it like as cold as you can stand and trying to stay in there, for 3 to 5 minutes and try to drive those hormones up to have some benefits as well. When is it not the proper time to use these types of therapies?
Absolutely. Just with any treatment, there are times you don't want to use them. With heat, you don't want to use it over an acute injury or a new injury, right? There's already a lot of blood flow there. There's already a lot of swelling. You don't need to increase that.
To make things worse.
Absolutely.
Make that swelling worse.
If there's an open wound, you don't want to be using it, as well as bruises or other things like that. There's also some diseases if
like
you
diabetes.
have. Absolutely. Diabetes, you're more prone to getting burned, and also any vascular diseases, you want to watch that, because increasing the blood flow could be detrimental.
Another thing that you think of is pregnancy.
Oh, absolutely.
Wouldn't want to get in a hot tub or a sauna if you're pregnant. Obviously not the right time for that as well. Cold therapies, what are some of the things that we want to think about avoiding cold therapy for?
Yes, so cold therapy, because it reduces blood flow, you don't want to use it if you have areas of your body that have poor circulation, or if you have nerve injury. If you cannot feel very well with your hands or feet, like if you have diabetes or neuropathy, you don't want to be using ice there, because you could be damaging it. Also, you want to make sure there's a layer of fabric or a towel or something between the ice and your body when you're applying it. There's also time restrictions to both of these.
Yeah.
I believe with ice, 15 to 20 minutes is about the max you want to go before letting it rest for an hour. With heat, you can go a little longer, but you don't want to fall asleep on a heat pad.
And you don't want to put these directly on the skin as well. It's just one of those things where it can really create immediate tissue damage if it's too hot or too cold. The other thing I'd say is if it's causing pain, go ahead and stop these immediately. You need to consult with a physician if these things are not resolving these conditions. The best way to know when to use these is actually working with somebody that can help diagnose what's going on and what the issue is. And if you're looking for some place to do that, obviously Zeal Integrated Health loves helping people with their issues like that. So check out some of our other videos, and remember to like, share, and subscribe below.